I am an orientation and mobility specialist.
I'm a lawyer.
I'm a firefighter.
I'm an advocate.
I'm a sister.
I am a mother.
I'm a friend.
I am me.
I have bipolar disorder.
Depression.
On borderline personality.
I'm not embarrassed.
1 out of 5 people lives with a mental health condition.
We're all people, and if we talk about it, there's hope.
Good afternoon. My name is Christopher Ramnauth, Community Engagement and Partnership Coordinator for Suicide Prevention at WNY Healthcare System. And this event is hosted by the Erie County Anti-Stigma Coalition. And I will be your moderator today as we explore the topic, Changing the Narrative, a conversation on suicide prevention. So before I introduce the panelists today, and before we get started, I just want to acknowledge that suicide is an intense topic for some people. So if you need to take a break at any point, please do so. And if you ever need immediate resources, you can call 988, the Suicide and Crisis Lifeline, or if you're a veteran or a service member, you can call 988 and then press 1 to get to the Veterans Crisis Line. So our program is approximately 1 hour. So during this time, if you have any questions or comments, please type it in the comment section. But now it gives me great pleasure to introduce our panelists today. So first, we have Dr. Celia Spacone. She is the coordinator of the Suicide Prevention Coalition of Erie County.
Good afternoon.
Next, we have Sarah Klaiber. She is the founder of Treasures Around Us and community member from the Erie County Suicide Prevention Coalition as well.
Hi, everybody. Pleasure to be here.
Hi, Sarah. Hi, Celia. And lastly, we have Cheryl Netter. Cheryl is the community and coalition member from the Genesee County Suicide Prevention Coalition and the GAL Pathway to Hope.
Hi, everybody.
Hey, are you all ready for some questions today?
Absolutely.
Yep.
Okay. So can you all provide a brief introduction about your role and work in suicide prevention in Western New York? And how did you get involved in suicide prevention? Celia, I'm going to start with you first.
Okay, thank you, Chris. Right now, I am the coordinator of the Suicide Prevention Coalition of Erie County. I work out of Crisis Services, and I coordinate the activities of the coalition, which is about over 60 members now, agencies, individuals, stakeholders who are all working voluntarily to try to reduce suicide in Erie County. I got into this work quite a few years ago when I worked at the Buffalo Psychiatric Center, from where I retired as the executive director 7 years ago. We took on a big initiative to try to reduce and prevent as many suicides as possible at the psych center. And we were able to do that for the last 6 years down to 0, which was a really great team effort. I also came in to this on a personal note, having lost a dear cousin to suicide. So I think that's what gave me the fire in my belly to really take this on as work in my retirement. And it's been a fabulous experience working with the coalition.
Thank you, Celia. Sarah, I'm going to go to you next.
Hi, my name is Sarah Klaiber, and yes, I am the founder of Treasures Around Us. The mission of Treasures Around Us is to support positive mental health through the connection of appreciation and happiness. So I'm the author of 2 children's books, and I spend a lot of time just making connections, mostly with our little ones that are unable to describe some, feelings that they might be having and don't have the exact words to. I am a volunteer for the American Foundation for Suicide Prevention. I'm also on the WALK committee and a proud member of the Erie County Suicide Prevention Coalition. And I became involved because a few years ago, I found comfort in sharing my personal story. I struggle with OCD and major depressive disorder, and I found comfort in community and people like the coalition and AFSP that just allow me to be myself and remind myself that it's okay to talk about my struggles.
Sarah, thank you so much. And lastly, Cheryl.
Hi, I am Cheryl Natter, and I am someone with lived experience. I have been diagnosed with bipolar disorder at a very young age and have been on a journey ever since. I attempted suicide back in, I don't even know now, it's been many years, but it launched me onto a journey of just being open, honest about it, and the people that I've connected with because of it is phenomenal. I'm also a member of the Gow Care Alliance in Genesee County, which covers Genesee, Orleans, and Wyoming, substance use disorder, and so forth. Very active in my church. I in fact have a group called Hope and Healing Connect, and we center not just on the spiritual aspects of our well-being, but the mental and physical too, and how they all come together. So that's just a little bit about me.
Thank you, Cheryl. And thank you to all the panelists today for taking the time and to tell us all about your journey. So my second question is, though, September is Suicide Prevention Month. What does that month mean to you? And what efforts in the community would you like to highlight? So Sarah, I'm going to start with you.
Well, the month means a lot. I mean, as soon as I found the bravery and the comfort in community, and, again, as I mentioned earlier, reminding myself that it is okay to share my struggles and to talk about things. I still today don't need a month to talk about the importance of mental health and suicide prevention, but the actual month of September just gives me permission to be even more vocal. And, through things like the Out of the Darkness Walk, where I'm very active on social media, and I'm not necessarily just talking about the kind of day that I had or a general "you are not alone" message, but join us at the walk. Here are over 3,000 people coming together with the same message that you've been listening to me give. The lawn signs that I have, I got 6 of them this year. So September is extra special to me because I can just be more vocal and in everybody's faces about this important topic.
Thank you for that. Cheryl, how about you?
For me, ditto what Sarah said, but I have never needed a day or a month or a week to talk about my journey. Every day is I just wake up in the morning and say, help me walk in the steps you've got for me today. And if it leads to a conversation with someone, being able to help someone with sharing my journey, I've always been very open, very honest about it. So again, the month of suicide prevention does provide a lot of opportunities for people to hear more about what is going on in the community. And I think that is just phenomenal. It's a well-needed thing, because sometimes we don't know what we don't know. And it's a good way of offering resources and attention to a subject that's really well needed.
Thank you, Cheryl. And how about you, Celia?
Well, for me, it means I'm busy. It's a busy month. And this year was a little complicated because my first grandchild was born at the very end of August, and out here in California, where I am now. So my work had to be done virtually. But I think what the whole notion is getting the community involved, getting the word out to the community, having the media attention. We do this work, I know the women on this call are so involved with this work year round, but during September, I have a chance to get the rest of the community to really have their ears open and their eyes open to this topic, and we love to take advantage of that opportunity. The coalition starts out by raising what we call the flag of hope outside the Erie County Rath building. The county executive helps us with that, and we have our county commissioners there of health and mental health. All our coalition members are invited and come out with their banners. So, and this is a media event where the message is in that flag. There is help, and where there's help, there's hope. And that's what we really try to get across to people, particularly during the month of September. And as Sarah mentioned, the walk is another opportunity. Besides people actually walking, there's tables with information and a keynote speaker that can help several thousand people, understand that this is something that doesn't need to be tucked under the covers. We have to have it out there. We have to have people able to talk about it and understand that, like, all those tables at the walk are agencies and people who can help you. You don't have to suffer in silence. We light the Peace Bridge up on World Suicide Prevention Day to highlight that and get people's attention. The city of Buffalo is lit. I know that the folks in Niagara Falls had Niagara Falls lit in the colors of suicide prevention. So those are ways that, we just don't have that chance during the rest of the year to really help people cue into this topic.
Thank you, Celia. What I'm hearing is that the work is not only happening in September, right? The work is throughout, and I'm hearing community. Community comes into play. And the idea that suicide is everyone's business. We oftentimes say that at the VA here, suicide is everyone's business. And that's what I'm hearing from all of you and all the amazing work that you're doing.
Chris, if I could mention, there was one other activity that I just thought was beautiful. One of the school districts took on Chalk the Walk, and all the kids went out and put messages of hope and awareness of mental health in chalk, in colored chalk, all along the sidewalks for the whole school to see. And that's the kind of thing, and I'm sure there were other things that I might not have even been aware of, but that, bringing the kids in to understand about, there is help and to support each other. It was just a beautiful thing. And I'm sorry I didn't mention it.
No, I'm happy you did. I think that there's so many different creative and unique ways that we can provide this support and this care. So thank you for bringing that up. So if anyone is just joining us, again, my name is Christopher Ramnauth. I work at the VA Western New York, and I'm their Community Engagement and Partnership Coordinator for Suicide Prevention. And I'm your moderator today. And today I'm happily joined by Celia Spacone, Sarah Klaiber, and Cheryl Netter. We've heard from our panelists about their role in working suicide prevention in the community, as well as what Suicide Prevention Month means to them. Now, I'd like to shift the discussion to stigma and our topic today, which is changing the narrative of conversation on suicide prevention. But before I get to that next question, I do have a question from the crowd. So speaking of children, how do we talk to a child about suicide? Can I go to Celia first?
Sure. That's a tough question. It's a complicated question, I should say, because it's going to depend on the age of the child, and it changes so dramatically over the youth's lifespan, and you really have to cue into the developmental age to know what they understand about death, and what they understand about the finality of death. If they've had any experiences, even losing a pet, to understand what death is about. I think there's some great information that the American Foundation for Suicide Prevention puts up. AFSP.org has detailed information about each age level and how to have that conversation. It also depends on where you're coming from on that. Are you talking about a child who's lost a relative to suicide and how to tell them about it? There are specific recommendations about that, and they would be very much based on the developmental age of the youth. From a younger child, talking more about it as so-and-so died because they had a problem with their brain. They had an illness with their brain. And the kind of overall guidance I like to say is, don't feel that you have to give the youth every bit of information all at once. Listen to their questions. What are they asking about? Sometimes with challenging topics like suicide or the facts of life, we get anxious and we like spew everything out. But I would listen to the child and hear what they're asking. What do they want to know? And try to respond to that at their developmental age. As kids get older, we get into the teen years. We're a little more frank about and complete about our discussion. But I don't want to say anything as a blanket, because it is so developmentally targeted. And the biggest thing you can do with a youth of any age is try to go into it with some comfort level yourself, that you're not afraid to talk about this. You're not afraid to hear their questions. If something has happened and everyone's a little tense, it's not a one-time thing. So you might, say to the youth, we can continue to talk about this. If other questions come to mind, I'm here for you. I always want to support you and have that discussion. So it's going to depend what you're coming in to try to tell them about.
Thank you, Celia. How about you, Cheryl?
For me, I'm sitting here thinking of a conversation that I had last year with my grandson, who was in, at the time, 5th grade. And I'm sure my daughter, he throughout his lifetime has heard of bits and pieces of my story. And he got in the car after I picked him up and mentioned that somebody was at school talking. They had an event of some sort talking about, and he was real funny about saying it, but he said suicide, kind of looking at me like with a question. And I said, oh yeah? And I said, what did you talk about, or what did they talk about? And he said, well, they just told about people who struggle and, that kind of thing. And I said, well, you do know about grandma? And he goes, kinda. Well, that just opened up the line right there. And I said, well, do you understand what suicide is? And he said, well, it's someone killing themselves. And I said, yeah, but there's a lot more to it than that. So I just shared just a little bit about my journey and, what I felt when I tried to suicide. And it was a good conversation. And that, Celia, is exactly how I ended. If you ever have any questions or concerns even, or if you're feeling like you're struggling, you can always talk to grandma,
Perfect.
So, and like I said, I've always been very open and honest, and it's never been a shameful subject for me. I've never carried the shame. Well, I can't say never. In the beginning I did, but as I've journeyed on, it's just part of who and how I am. And if I can help someone by going through a struggle, I'm going to do it.
Cheryl, I love what you did about using the word, and at the point where your grandchild was ready to hear. It's not that you imposed it upon him out of your need. You know, it was his time frame, and you showed that we can talk about it by using the word, you know, not trying to use some euphemism that really emphasizes the stigma. If you can't talk about it, then there's something wrong and there's something shameful. So kudos. And right off the cuff in the car when you weren't expecting it coming.
No, not expecting it at all.
And you left that door open, Cheryl.
Yeah.
Which is so important. So thank you. And how about you, Sarah?
I definitely do think there's a lot to do with the age, where you have to just kind of, you know, analyze what, you know, they may have experienced and, you know, again, at what age they are. But I think when it comes to an experience, like somebody that may have experienced a loss by suicide, it's okay to say that that person was, because they had an illness, and you're not saying anything that's fabricated by saying that. If it comes to concerns of a child, again, I think it has to do with the age, but at a very, very young age, I think that we can just show that we care and understand, and, you know, just switch the words. Like, instead of ideation, maybe, you know, I understand you might be confused. Instead of depression, are you feeling lonely? And, you know, so there's words that we can put that are more in their terms and helping them know that we do understand.
Thank you for that, Sarah. So my next question is, when thinking about stigma and suicide prevention, what comes to mind? What barriers does stigma create in prevention efforts? I'm going to start with Cheryl.
Perfect story for me is when I was in a coma for 3 days after I tried to suicide. And on the third day, when I awoke, there was a nurse standing over me. I was in ICU, and she said, "Do you know where you are?" And I looked around and I said, "Yes." She goes, "Do you know what you did?" And I looked around and looked at her and I said, "Yes." The next words out of her mouth, and this is where some of the stigma lies, is she said, "Do you know how selfish you are?" Now, that has stuck with me for all these years and still sticks with me today, because in my mind at that time that I tried to suicide, I felt totally with all my being that I was doing the most unselfish thing I could do for those who loved me, because I was just worthless. I was worth nothing to them. And, you know, all these things were in my mind. And like I said, I believed them with my whole being. So I think that is a stigma that still stands today. People will say, I've heard it said, you know, that's the most selfish thing you could do. But it's for the person in the shoes, it can be just the opposite. So I think words are powerful. They have a lot of power, both negative and positive. And when we're talking with someone, we should be very, very acutely aware of the words that we use too.
Words are powerful, if you all can see below us. And Cheryl, I just want to thank you for feeling safe in this space. To tell us your journey and to tell us that. So thank you. Celia, how about you?
Yeah, thank you for that story, Cheryl. It crystallizes exactly what, you know, a simple comment to somebody can set them back so far.
Mm-hmm.
What I always say, something that's always safe to say, because people, they get nervous, they don't know what to say. Just say, "You're sorry. I'm sorry you're going through this." If you're ever, you know, dealing with someone who is thinking of suicide or has attempted, "I'm sorry, and I want to help." That's all you have to say. Now, in terms of stigma, something to keep in mind is that about 2/3 of the deaths by suicide are men in the middle years of their lives. And I think that that is a reflection of stigma in great part, not totally, because we know men choose more lethal methods, but they're much less likely to get mental health help. They're much less likely to get even physical help. And there's a particular stigma that affects men who, that whole macho, I have to be tough and be a man, and not to admit that they are struggling with something where they could get help. And these are people, these are fathers and brothers and uncles and productive people that we're losing in a very productive time of their lives to suicide. And I think it's so much tied to the stigma that particularly affects men. When doing a screening in a doctor's office, which many of them do now, which is wonderful, but the men will typically say, "I'm fine." And, we found that physicians were referring women for mental health services much more frequently than men. And it's because the men say they're fine. And the women typically will be more likely to say, "I'm struggling." That's the golden key to getting help, is to say, "I'm hurting, I'm struggling, I'm having these thoughts." So that's a concern I always have about the issue of stigma. It shuts the door, to help.
We just had in Genesee County an event that did raise some controversy, but we held an event for specifically men. Women were there too, but it was for Suicide Prevention Month, and we held it at the Firing Pin, which is a gun shop in Bergen, New York. And we had she's a girl on our coalition. She did a little bit of a safety speech, if you want to call it, and spoke about suicide prevention and the importance of gun safety and everything. And it was so well attended. We gave out free t-shirts. We had different tables set up, from like the mental health clinic was represented, and our suicide prevention coalition, and we had 988 numbers and all kinds of information about that. So it was really, really good. And there was a lot of positive feedback from it, from the attendees. So just thought I'd throw that out there.
I'm happy you did, Cheryl, because it sounds like we can really concentrate our efforts. And I think, Celia, you're about to say something as well.
I was going to say Chris knows well about these types of efforts, because he's been leading a lot of them for the coalition. It's hard to reach men, particularly, and we know that they often choose firearms, which has very little chance of a second chance.
Right.
People who attempt suicide and live, 90% of the time will not die by suicide. But with a firearm, there's typically no second chance. And that's the tragedy of it. And Chris has been working with our means reduction committee to get the free gun locks out in the community, have those conversations. We did a promotion to give free gun locks and suicide information and a pair of warm socks to hunters when they were picking up their hunting license and their doe tags. Last year, we reached 1,500 individuals, and mostly men, not all, but mostly men. A barber shop put on an event where they cut hair, and Chris helped that one to get going. He's going to be too modest to brag about all the work he's done, but that they cut hair 24 hours and raised thousands of dollars and increased awareness among men that this is an issue. So, we're trying to be creative. We're trying to break through that stigma and to get folks where they are and have them hear the message that there is help.
We also had a raffle for a free gun safe, which that was huge too. So
That's part of what we do at the gun show. There's a big gun show in Erie County. I think they get about 3,000 to 5,000 people coming through, and Chris has
I've
been
been there.
leading the tabling. You've been there, okay?
Yep.
And
Yep.
we have great conversations, and I think it helps reduce the stigma. It really does.
Absolutely.
And how about you, Sarah?
I think that unfortunately with the word stigma also comes silence. And I think that can be very, very dangerous. And, people that are battling mental health, I think that they think that it has to take away the labels that society gives them. Like, we have to be the strong man, we have to be the perfect parent, we have to be, the model employee. And, when you're battling things that are unseen, there's just unfortunately a silence that comes with that. And, I'll share an example that I always give to help people kind of resonate. So if I were to be, walking into my normal work day, and let's say that I were on crutches, I had, an injury to my leg, for example, people would instinctively hold the door for me or instinctively help me tie my shoe because they could see that there is something wrong. But in my case, I can open my own doors, I can tie my own shoes, but I might walk into work a little glassy-eyed or disheveled. And there's also a judgment that sometimes comes, and I'm not saying that it's on purpose, but, somebody might look at me and think that I'm unstable or, abusing drugs or something where, no, I just had a small moment of crisis in the car a minute ago. So, that's the thing that is always very frustrating to me about stigma is the silence that is attached to that, and therefore some judgment that can take place.
Thank you, Sarah. I have another question from the audience. So this audience question is, I've read that religious beliefs can often be a factor in suicidal ideation, action, and response, both positive, spiritual help, and negative, taboo and stigma. How prevalent is this intersection in your work? And are there religion-specific upstream, downstream resources established in Western Europe to help with suicide prevention messaging and outreach? I'm going to start with Cheryl.
For me, my faith has played into my whole life. And I can remember the day that I came out of the hospital. I was by myself. And if I cry, forgive me, but I came out of the elevator and I can remember walking outside, and it was like my life was starting over again. And at the same time, I was questioning, what is my purpose? And I can remember looking up and saying, God, I know it's not your will that anybody takes their own life, but why did you spare mine? Well, after all these years of walking the walk, I know now I did have a purpose. I've met so many wonderful people and been able to share my story and help others. I have a church. I go to the city church in Batavia, and we're very open, very welcoming about any kind of mental health struggles. We set up in September for suicide prevention, usually for at least a couple weeks at church on Sundays, and offer, information and so forth. So for me, the faith has played a positive role in my recovery and my walk. So that's all I could say. It's about me, but that's how it's been for me.
Thank you, Cheryl. And I remember tabling with you at that church.
Yep.
How about you, Sarah?
I think that with faith and religion does come that sense of community. And for those that maybe aren't as religious of a person. They have other outlets, perhaps a gym, perhaps a hobby, or another type of community that they belong to. So no matter what your definition is of community, I think it's very, very important to find that, to help again know that you are loved and supported. I think a part of what the question was, with some religions come expectations of how others think that we should perform in life, or beliefs that we should have, and we as human beings cannot control how we love and how we feel and how we think. So I think in some cases there are pressures that can happen to individuals that make life just a little bit harder, and all the more reason to find that community in those other outlets.
We're getting back to that word of community again. It's like a common theme in what we're talking about, right? So thank you, Sarah.
And
Celia,
I'm sorry, Chris. I just wanted to add, I was looking at that question. I have also been in groups of people who have been, in a church, and there is a stigma attached to mental health. I've been with people who've said, you shouldn't take medication. You should be free from medication, and things like that. But for me, I have always felt that, like I said, I pray every morning, help me walk in the steps you've got planned. And doctors have been put in my life, counselors put in my life, and I believe that it's all part of a plan. So for me, I think it's a perception that you really have to focus on. And sometimes you just have to learn how to filter things for yourself too. Even though people like to come at things with the right heart, sometimes it's just not the right advice, I guess. It's a personal thing. I think that's what I'm trying to say.
Yeah. No, absolutely. How about you, Celia?
Well, excellent questions coming out, very thoughtful questions. And I think besides what Sarah and Cheryl said, we've appreciated as a coalition the strong role that religion and pastors can have in a person's life, and have wanted to try to educate them so that they have the same, because many have gone through the religious training and not gotten too much on mental health topics. So we want them to appreciate how strong of a role they can have in prevention. One of the areas where we've targeted is the rates, typically suicide rates have been higher amongst white Americans, but we are seeing a disturbing trend of youth of color, young boys, increasing at a higher rate, and sort of catching up, unfortunately, bringing it down a little bit for white youth, and it's coming up in youth of color. So we know that particularly in that community, in those communities of color, the church can be a wonderful support. And so there is a program that we help to bring to Western New York called Soul Shop for Black churches, where pastors are trained in how the strength they have to help people and how to use that in a positive way rather than a stigmatizing way. And the Buffalo Federation of Neighborhood Centers has taken this on and continues to offer these workshops where they've trained numerous pastors to be a resource for people. I think that's where we have to go. Sometimes the religious message can be, that suicide is wrong, can be a prevention for someone in that final moment. I wouldn't do this because God wouldn't want me to. But if it's too strong, where the person feels they're bad because they have the thought, then that's going to go in the other direction and prevent them from getting help. So there's ways to direct that very strong potential for ideation and for action in a positive way. And that's what we're trying to support. We'll go to any church group and do a talk on suicide prevention and what helps and what doesn't help. And that community can be fabulous.
Sounds like we will go where the community needs us.
Absolutely. And you know that, Chris, because we've gone everywhere.
Absolutely. My next question for all of you is, what are some effective, non-judgmental ways to ask a friend, a family member, or a colleague if they're thinking about suicide? And I'm going to start with Sarah.
For as long as I've been involved in this community, we'll say that word for the thousandth time, but I have recently attended with our friend Cameron two trainings, QPR trainings. And just when I thought that, I don't want to say expert, but just when I thought that I knew quite a lot about conversations, I just recently in the past 2 weeks learned some things. I learned that instinctively, because suicide to many people is it's just a word that is uncomfortable. Sometimes people will look at somebody and say, "You're not thinking about hurting yourself, are you?" And I think I've said that several times, and those are two completely different things. Cameron referred to a friend of hers that is not at all having any type of suicidal ideation, but she does struggle with mental illness, and she has a habit of snapping rubber bands on her wrist. So, she might answer, "Yes, I'm thinking of hurting myself. In fact, I'm doing it right now." So, we sometimes want to soften the word suicide because it's uncomfortable for us to say, but hurting yourself and ending your life are two dramatically different things. So I would say, as difficult as it sounds, if you really do have concerns, say the word. Say the word, and don't ask it in a question like, "You're not thinking of that, are you?" Like, "I'm concerned. I love you. I'm noticing some changes, and I have to ask if you've been having thoughts about suicide." Say the word. It'll save a life if you just get over your own levels of of being uncomfortable and say the word.
A direct and clear question.
Mm-hmm.
Thank you, Sarah. How about you, Cheryl?
That's exactly what I would say. Don't sugarcoat. I saw one of the questions that you had here, Chris, was how would you ask someone? Well, if you're in a position where someone and you are talking and your question is there, then more than likely they're struggling with something. So just to open the door a little bit, you could simply say, "Are you struggling right now? You can talk to me." There's a trust level that you have to kind of come to with a person. But I have always found the more open, honest, and authentic I am with someone, the more open and honest they will become with me. And so I approach it with a very non-judgmental attitude, I guess, because when I went through my darkest times, I didn't have anybody that would approach me to talk to me about what I was feeling. Had I had someone that I could openly and honestly talk with, other than my counselor, it would have probably made a huge difference for me, just to know there was someone that I could open up to and have them not be like wide-eyed and jaw dropped kind of thing. So
if I might add to that, keep in mind that if we are with somebody that really is struggling, they've probably been struggling for a while, and just like we talked about a couple of questions ago, they feel like a burden, they feel like a bother, they feel ashamed and embarrassed. So they don't want to bring it up, and oftentimes when you're the one that brings it up first, you'll actually see their body language, like, oh, they noticed. Now I can talk about it because they brought it up first. So it's important to keep that in mind too. They probably don't want to talk about it, and you're offering them a relief or a release.
Yeah.
We all have a part to play in this, right? We all can provide support and be there for one another. So thank you both. How about you, Celia?
Well, I have to compliment Sarah. She did the training, and she really picked up on all of the good points of it. I think the training you did was QPR, question, persuade, refer. It's one of the trainings we offer, as well as Crisis Services offers that through Cam Burns, who does a great job with it. We also do Talk Save Lives. It's like a 1-hour program that we could do in any for any group and give you some details about how to have that conversation. But the high points that, besides what Sarah and Cheryl have said, have the conversation in private. Find a private spot, but not isolated, because you might be opening up something that you're going to need some help with. So you don't want to go on a hike up at the top of a mountain and then have the conversation. So private, but place where you can get some help if you need it. Your attitude about that we can talk about this is the most important thing. So a direct question, don't beat around the bush. The other thing I think helps and reduces some of the resistance you might see, or the reticence about talking about it, is to share with them what you see. And these are some of the warning signs. I've noticed lately that you don't go out with us anymore. You're kind of not taking care of your clothes and your hair like you usually do. Give them some observable things that you see, because that builds your case a little bit. If you just say, "Hey, are you okay?" It's too easy to blow it off. Okay, so if you can give them some observable facts and then ask the question directly. Sometimes when people say and do some of the things you're doing recently, they're thinking about taking their life, or they're thinking about suicide. Is that what's going on for you? It's a hard thing to do. The worst that's going to happen is they're going to laugh at you and say, "No way," that's okay.
Yep.
Better to have reached out and show that you care. And then the other thing, people don't want to ask the question because they don't know what to do if the person says yes. And so that's where you come in with my favorite little phrase. "I'm sorry you're going through this. I want to help. Let's find a way to get you some help."
Yeah.
If it looks like it's imminent, that they are really in process of acting, and that's where you want to, dial that 988 or crisis services number, the numbers that are flashing up on the screen. Or if something has happened, 911, of course, if it's a physical interaction at the time. So there is help out there, and that's what the message you want to get to the person. There's help. We can make this better. I want to help you.
Yes, I've had conversations with people where I've had to ask them flat out, "Do you need me to call 911 with you?"
Yeah.
And I always like to put "with you," not "for you," because I want them to know they're not alone. I'm in it with them.
And tell, when you're calling 988 or calling to get a referral for somebody, tell them what you know. Don't say, "Oh, I have Mr. X here. He's a little upset." No, he just told me that he's thinking of taking his life. He has a method worked out, and I'm very concerned about him. And then, he's there on the line. Be open.
I think you all put a really tangible framework out for our listeners today of what to do and how to do it. I have another question from the audience. How is the current discussion about assisted suicide impacting your work? I'm going to start with Celia.
That's a tough one, Chris. I have to be honest and say that we haven't taken an open point of view on that as a coalition. We, there's, it's controversial. I don't have a personal strong feeling at this point about, I mean, I understand the importance of having that available, and I'm speaking as a personally now, not on behalf of the coalition. And where I run into concerns that I haven't worked out for myself is, do you say mental illness falls into that category? And if someone has struggled with mental illness for a long time, would they fall into assisted suicide? So, yeah, I guess I have to say I'm just not sure.
Yeah, I appreciate your answer, though, and that's fair. How about you, Sarah?
I agree with Celia, and I'm glad that you asked her to respond first.
Me too.
Yeah, thanks.
It's tough. Back we had a similar question in the QPR training that I attended. The one I attended a couple weeks ago. I did it twice so far. About somebody that is struggling, for like they got a poor diagnosis, or they lost a significant other, or I think the question was, have you ever taken away the word suicide, where technically it was, but there was another reason, like there was a woman that said that she just didn't want to eat anymore. She was so lonely and so sad from the death of her spouse that she just wouldn't eat anymore. I mean, would that fall into assisted, when clearly people are letting her not eat? So it's really tough. And I think right now, if I were just forced to answer that, just go back to being there and showing love and showing care, and just being there genuinely.
Thanks, Sarah. How about you, Cheryl?
Well, it's funny because it brings to mind back in 2013, I think it was, I had an uncle who was terminal, and he made the decision to just go into hospice care, stop his meds, the whole 9 yards. And I was his healthcare proxy at the time. The only one he really had. My aunt had passed away and they had no children. So I abided by his wishes. And basically that's what was happening right before my eyes. He was choosing to die. So for me, it's a personal thing, I think. And it's something that it's hard to just say yes, no, it's right, it's wrong. It's really something that you really have to reflect, I think, on and figure it out yourself.
Thank you for that. And thank you for all the questions, too, from the audience. They've been really great questions. This has been an amazing conversation. And I know we're getting closer to the top of the hour. And I wanted to end off with this question for all of you. So for anyone that is listening live, or anyone that may listen on the replay, so for someone who is struggling now, what message would you like to share with them? So again, for someone who is struggling now, what message would you like to share with them? Cheryl, I'm going to start with you first.
I think for me, it would be just because I am an attempt survivor and lived experience, and in the conversations that I have had with people, they're not alone. I know how it feels when you are struggling. You feel like you're the only one, but you're not. And so I think you're not alone. There's help out there, and you can find someone to walk with you. I don't have anybody's answers. I'm a recovery coach too, and one of the things that was brought out specifically was when you're meeting with someone, you don't have their answers, and it's not up to you to fix them, but they have their answers, and you're just there to help them find it. So,
Well said, Cheryl. How about you, Sarah?
Same 4 words. It's that simple. You are not alone. I think loneliness is attached to mental illness because some people feel that they just can't talk about it because of that fear of being a burden or embarrassed. So they create a lot of this loneliness themselves. And there's no magic sentence. It's those 4 words. You are not alone.
That's all we need, right?
Mm-hmm.
Thank you, Sarah. And finally, how about you, Celia?
Well, everything Cheryl and Sarah said, and I'll add my own little twist to it. Make your house safe. If you're struggling, we know now that sometimes suicidal impulses can come on quickly, and they also can dissipate quickly. So make your house safe. Get the firearms out. If you go to our website, suicidepreventionecny.org, it's been flashing up on the screen. There's a map for Erie, Niagara, and Genesee counties of places where you can safely, voluntarily bring your firearms during times of crisis. Just get them out of the home for a while. Get all the old meds out of the house. Clean your house out, and make sure you don't have anything readily available as you're going through that crisis. Find ways to distract yourself. Get help. Help actually works. And I've had so many people tell me that story, that they were at the point of taking their life and something intervened and stopped them, and they got help. And then I meet them 10, 20 years later, and life is good. So get help, clean out your house, and realize that there are so many ways to get help out there, which have been coming up on the screen. If you've missed them all, there's lots of agencies that'll work with you, but just dial the 988, and you know that you will get connected to someone. And it can change. It can get better.
Absolutely. So as we look towards wrapping up our program today, I just want to thank all 3 of you being our panelists today. So Celia Spacone, Sarah Klaiber, and Cheryl Netter. You all took this time and we created this safe pocket of this conversation. And it was amazing to hear about all of your journeys and all the amazing work that you do. I've had the pleasure of connecting with all of you in different ways, and you all are amazing pieces of the Western New York community for success. So thank you. I'd also like to thank everyone behind the scenes. So Mike Telesco from Telesco Creative Group, and everyone on the Erie County Anti-Stigma Coalition Outreach Committee. Keep a lookout for our next monthly Facebook Live event. And if you joined us late or want to tell anyone about this episode, all the Facebook Live programs will be available on the website, letstalkstigma.org. So together, we can reduce stigma and create safer environments in our communities. So on behalf of the Anti-Stigma Coalition, I want to thank you all for joining us today.
Thanks for having us.
thank you for the opportunity.
Thank you.